Welcome to Male Secret 60 Plus. Today, we're unveiling a secret many men keep, a topic vital to our quality of life after 60. Most men don't realize that their intimate health ages just like their heart, brain, or bones. Ignoring this reality doesn't just reduce your function, it can undermine your confidence, dignity, and connection with those you love. I'm Dr. Jane Talon, and it's a pleasure to be here on Male Secret 60 Plus. As a urologist and medical professor with over 3 decades dedicated to men's health, my expertise is helping mature men like you preserve not just virile function, but your identity as a man. Now, imagine if I told you that the primary cause of performance challenges in men over 60 isn't directly tied to age, but to habits you can change? And that a simple daily practice without needing medications could transform everything? In this video, I'll share 5 essential ways to care for your masculine intimate health, all backed by science and tailored for men over 60. These aren't tricks, but real, practical strategies that can save not just your performance, but your health and quality of life. Stick around until the end, because I'll reveal an extra tip most doctors rarely mention, yet it can prevent one of the most painful and concerning conditions affecting men our age. Before we start, if you're new here and value reliable information on mature men's health, subscribe to our channel. Click the button, turn on the notification bell, and join our community. Your tips and questions matter. If this topic interests you, comment with the number 1. If you feel something could be improved, comment with a 0. Your feedback helps us create the best content for you. Let's begin with the first, perhaps most misunderstood aspect of caring for men's health as we age: keeping your member in use. Because the truth is clear, if you don't use it, you lose it. 1. Stay active in your intimate life. When I talk to my patients in their 60s, 70s, or beyond, one phrase I hear often is, "Doctor, I think my intimate life is over." Many men silently accept that virile function simply fades with age, as if it's an inevitable fact. But I want you to know something crucial. This belief is not only false, but may be the primary cause of your function's decline. Your male organ, like your muscles, heart, or brain, relies on regular use to stay healthy. When it remains inactive for long periods, blood flow to the area decreases, tissue elasticity weakens, and atrophy can set in. This isn't a scare tactic, it's basic physiology. The medical term is disuse atrophy, and it's far more common than you might think. The great news? It's entirely preventable. Intimate activity, including solo stimulation, isn't just about pleasure, it's about preservation. Regular blood flow to the region is vital. It keeps tissues healthy, oxygenated, and functional. Think of it like stretching a muscle to prevent it from shortening and weakening over time. If full intimacy isn't possible or comfortable right now, that's okay. There are other methods, like doctor-approved vacuum devices or pelvic floor exercises, that strengthen the area and improve circulation. The key is not to stay inactive. Your body responds to stimulus, no matter your age. Beyond the physical benefits, there's an equally vital layer: dignity and identity. For many of us, intimate vitality is deeply tied to our self-image. When it wanes, confidence often follows. Staying active, in whatever way works best for you, helps reclaim not just performance but pride. It's not about being the man you were at 25, but connecting with who you are now, a man with wisdom, experience, and courage. I've seen men in their 70s regain control of their intimate health with just this first step. And the fascinating thing is, when this happens, other aspects of health improve too. It's a virtuous cycle. Confidence fuels more intimacy, which in turn drives motivation. Now that we understand the importance of staying active, let's address something equally critical, something every man thinks he's mastered until it's too late. let's talk about hygiene. Second, practice proper hygiene. It may sound basic, but after 3 decades treating men, I can assure you, proper masculine, intimate hygiene is one of the most overlooked forms of self-care, and its importance only grows with age. I've seen countless men with infections, irritations, or even far more serious conditions simply because they didn't know the right way to clean. It's not about a lack of cleanliness, but a lack of knowledge. Aging changes our bodies. Skin becomes more sensitive, the immune response weakens, and the body no longer fights bacteria or heals minor irritations as quickly. This means the hygiene routine that worked in your 30s or 40s may no longer suffice. For uncircumcised men, extra care is essential. Bacteria, sweat, and dead skin cells can accumulate under the foreskin, creating a breeding ground for infections like balanitis and other conditions that increase the risk of serious issues, including penile cancer. Yes, cancer. It's not rare. Brazil, for example, has one of the highest rates of penile cancer globally, with poor hygiene as a leading cause. This risk doesn't decrease with age, it increases. The solution, thankfully, is simple. Gently wash the area with warm water and a mild, fragrance-free soap. Avoid harsh products. If uncircumcised, carefully retract the foreskin, rinse thoroughly, and, most importantly, dry completely. Moisture is a breeding ground for bacteria, especially in skin folds. Also, clean the area after every intimate activity. Bodily fluids, lubricants, and sweat can disrupt the skin's natural balance. It's a habit that takes just a minute, but can spare you painful infections, unpleasant odors, and far more serious issues. What surprises many men is the emotional shift this simple care brings. When you treat your body with this respect, caring for every part of it, you start to feel different, cleaner, more confident, and more in control. That's immensely powerful, especially in a world that sometimes suggests older men should resign themselves. But hygiene is just the start. There's another hidden danger many don't know about, one that begins in intimacy when you're not fully prepared. 3. Avoid intimacy before full firmness. This may come as a surprise, but it's a common issue I see in my practice. Men who unknowingly injure themselves during intimacy simply because they're unaware of the risks of starting before a full erection. It might seem like a small detail, especially when desire is strong. But attempting penetration with a semi-rigid member can cause cumulative damage with life-changing consequences. Your male organ isn't just a tube of skin. Inside, it's a complex, delicate structure of blood vessels, spongy tissue, and smooth muscle. When it's not fully firm, this structure lacks the support needed to withstand the pressure of intimacy. Forcing the situation can cause microtraumas, tiny internal injuries that may not hurt at the time, but over time form scar tissue. This scarring can harden and pull on tissues, leading to Peyronie's disease. If you've never heard of it, Peyronie's disease causes painful curvature of the member, which, in severe cases, can make intimacy difficult or even impossible. I've met many mature men too embarrassed to mention these changes, waiting until it's too late for simpler treatments. Most didn't know this risk existed. They weren't reckless, just uninformed. My advice? Take it slow. Your health, comfort, and confidence depend on treating your body with patience and respect. Waiting for full firmness isn't just safer, it's smarter. It protects you from long-term damage and ensures a more pleasurable, pain-free experience. Use lubricants to reduce friction and spend time on foreplay and stimulation. Talk openly with your partner if you feel any pressure. It's not worth taking risks. If you use erection medications, wait for their full effect before proceeding. This simple precaution can save years of frustration. It's not a sign of weakness, but of wisdom and self-awareness. Now that you know how to protect your physical body, we need to focus on something that affects the mind and brain, one of the biggest hidden threats to connection and desire in later years. 4. Limit adult content and maximize real connection. Let's be honest, we live in an era of unlimited access to visual stimuli. For many older men, especially those who are single, widowed, or feeling lonely, adult content might seem like a harmless way to keep desire alive. But after decades in clinical practice, I can assure you, what starts as occasional relief can gradually replace something far deeper and more fulfilling, real human connection. The truth is, excessive consumption of explicit material can rewire how the brain responds to arousal. It conditions the mind to a specific type of stimulus: fast, visual, and solitary. Over time, this can lead to a phenomenon called desensitization, where real-life intimacy, with its nuances and emotions, no longer triggers the same response. I've heard men in their 60s and 70s express confusion. They still feel desire, but in the presence of a partner, their body doesn't respond as before. They think something's physically broken, but in many cases, it's psychological conditioning. Excessive consumption can also foster feelings of shame and isolation, eroding self-esteem, especially when it becomes a private routine that pulls you away from human closeness. You might start questioning your masculinity and worth in a relationship. That's a heavy burden. I'm not here to judge, but to recommend moderation. If you consume this content, do so sparingly. More importantly, focus on rebuilding your natural arousal pathways. Through memory, imagination, and above all, genuine emotional intimacy. Spend more time on foreplay, talk openly with your partner, and allow yourself to feel without pressure. Desire doesn't die with age, it just needs a different kind of attention. Limiting artificial stimuli doesn't mean giving up pleasure, it means reclaiming it in a healthier, more meaningful way, restoring harmony between body and mind. And speaking of harmony, there's one final piece that ties it all together. The foundation that supports not just your intimate health, but your overall vitality. 5. Prioritize lifestyle over quick fixes. If there's one truth I've learned in all my years of medicine, it's this. Your lifestyle directly reflects your viral health, far more than any pill or prescription. Many patients come to my office expecting a quick, magical solution. But no medication can match the power of consistent, healthy habits. Your lifestyle is the engine that drives everything, from blood flow to hormone levels to mental clarity. Erections depend on good blood flow, which relies on a healthy heart and vessels. Smoking, excessive drinking, or poor diet damage these vessels and limit circulation to the body's most vital parts, including your male organ. Erectile dysfunction is often one of the first warning signs of heart problems, your body's way of signaling that something deeper needs attention. The good news? Every healthy choice you make today has an immediate and lasting impact. Quitting smoking improves circulation in days. Reducing alcohol can start rebalancing testosterone levels. Walking 30 minutes a day and eating foods like vegetables, leafy greens, and fatty fish not only extends your life, but enriches it. You regain energy, boost confidence, and gradually, your function follows. What I love most is seeing a man realize his body isn't broken, it's responsive. It's waiting for you to care for it again. I've seen patients transform their lives by changing their routines. They sleep better, laugh more, reconnect with their partners, and rely less on pills because they've built a solid health foundation. So, before seeking a prescription, lace up your shoes for a walk. Choose water, prioritize rest, connect with others. Your body listens to how you live. Now, the final tip I promised. It's simple but powerful and could be the key to protecting your virility as you age. Bonus tip: Sleep without underwear. It may seem trivial, but the most discreet habits often have the most surprising impact. Sleeping without underwear is one of them. During sleep, your body enters a natural repair state. For men, this includes spontaneous nocturnal erections, essential for keeping erectile tissue healthy and oxygenated. Tight underwear, like snug briefs, can compress the area at night, restricting blood flow and causing irritation. Over time, this constant pressure can contribute to microscarring, which, as we've seen, may lead to Peyronie's disease. Choosing to sleep without anything or with looser underwear gives your body the freedom to recover naturally. It's a small change with big long-term benefits for your health. Talking about intimate health can be uncomfortable, but your relationship with your body doesn't end with age. It evolves. And how you care for it now matters more than ever. Staying active, practicing careful hygiene, protecting yourself during intimacy, limiting overstimulation, and embracing a healthy lifestyle, and yes, even sleeping without underwear, aren't just medical tips. They're small acts of self-respect and dignity. Each one reinforces your vitality, your connection with yourself, and your worth. I've had the privilege of helping countless men rediscover confidence in their bodies, not because they chased lost youth, but because they committed to caring for themselves. You're not alone. The good news is, it's never too late to start. Every day is a new chance to make a better choice. Your health doesn't define your worth, but it reflects the care you give yourself. And when you care for yourself, it shows in everything you do. Thank you for being here, for listening, and for choosing to invest in yourself. You've already taken the most important first step. Let's continue this journey for men's health together, because caring for yourself is never something to be ashamed of, and it's never too late to begin. The content presented on the Male Secret 60+ channel and in this video is strictly for educational and informational purposes. The information shared is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your doctor or another qualified healthcare professional with any questions you may have about a medical condition. Never disregard professional medical advice or delay seeking it because of something you have seen on this channel.